the AI-powered Epidemic Early Warning and Response Dashboard, a comprehensive tool designed to provide proactive insights for health policymakers. This dashboard is powered by Gemini AI and integrates state-level epidemic data. On the main screen, we can see a snapshot of the data loaded. We have around total data of 46,000 records and of 37 states and union. Moving to the epidemic solution section, this module allows us to visualize and simulate the spread of infectious diseases using real-time trends and predictive AI models. It is essential tool for early intervention and strategic planning. Next, we have the resource allocation panel. The resource allocation panel enables decision makers to understand where medical infrastructures and support systems need to be prioritized based on current and projected outbreaks. The community and alert section plays a key role in risk communication. It provides timely alerts and engages communities through verified information, ensuring public awareness during potential health crises. Coming to the historical trend analysis, now let's dive into the historical trend analysis. This feature allows us to select a specific state and track the epidemic's evolution over time. Now let's select West Bengal and see what happens. I'm selecting West Bengal. Okay, now here we can see that the dashboard is plotting 1254 data points ranging from March 17, 2020 to August 2023. This visual trend helps in understanding how the outbreak behaved historically, which is critical for forecasting and preparedness. Now let's go to the state-wise hotspot analysis. The state-wise hotspot analysis gave us the power to map regions based on various health indicators. I am selecting here the active cases of various states, and the system generates a geographical distribution of these cases, helping us to identify real-time hotspots and that is required immediate attention. And here it gives us the summary of the interventions that has to be focused for testing and tracking the data. Now coming to the next page, that is the epidemic simulation page. One can set parameters such as basic reproduction rate, the recovery rate, and the simulation rate. And if one don't know what wants to know more about this terms, one can get cleared here. And this is the visualization of the SIR model simulation results. Here is the summary of that. Here gives the key simulation outcomes where it tells about the infected counts, the day of peak infection, and the total population. This is again this AI policy recommendations. Coming to the next page. Now we are on the resource allocation page, a game changer when it comes to planning healthcare infrastructure during epidemic. This section uses the center model, a powerful mathematical optimization method. It helps us identify the best solution for best possible location for new healthcare infrastructures such as testing centers, hospitals, or vaccine storage facilities based on the population distribution and the outbreak severity. Here we can adjust the number of facilities to be deployed. For example, here to place just from one facility to many facilities, let's place 15 facilities and just run this. So a system reports the maximum distance to a new facility is 415 kilometers, that it represents different locations at their latitude, longitude, and here is the um, visualization of different places where these facilities can be done. And here is the result of the p-centric algorithm. Moving on to the next page, that is the community and alert system. In this page, this is now we are on the final and the one of the most impactful part of this dashboard, AI powered public service announcement generator. This tool is designed to help quickly create clear, effective, and culturally sensitive public health messages tailored to different audiences across India. Here, PCA selects here you can select your topic. Here I am selecting vaccine drive and the target audience. Here let me select the general public, and the message tone, that is I have selected informative and direct. Informative, but you can choose tones like reassuring, urgent, empathetic, etc. Here I am selecting informative, and once the input has been done, we can generate our PSA. So this gives our PSA. This generator is ideal for government agencies, NGOs, schools, hospitals, and even social media creators who need to roll out timely health messages at a scale. It saves hours of creative writing, ensures message consistency, and most importantly, it connects with people in a meaningful way. With this PSA generator, we are not just informing, we are inspiring action. Together with the power of AI and compassion, we can build a safer, healthier India. Thank you.